Dilation of the renal pelvis for any reason is called pyelectasia. Pyelectasia can result from aggressive IV fluid therapy or diuretic therapy, pyelonephritis, or a distended or obstructed urinary bladder or ureter. A dilated renal pelvis is anechoic or pure black, whereas the medulla is hypoechoic compared to normal renal cortex. If a patient's renal pelvis is dilated and the patient is not receiving IV fluids or diuretics, you should suspect pyelonephritis. Patients with pyelonephritis are expected to show symptoms of polyuria, polydipsia, lethargy, anorexia, and a low urine-specific gravity. However, symptoms are often so gradual in onset that the owner will accept mild symptoms as normal behavior. Therefore, pyelectasia due to pyelonephritis is often an unexpected ultrasound finding. In chronic renal failure, urine-specific gravity is isostenuric, 1.010 to 1.012. Dogs and cats with pyelonephritis are often confused with cases of chronic renal failure. These animals may have a mild elevation of BUN and creatinine, but the urine-specific gravity will be actively diluted. Urine-specific gravity of 1.009 or less. In cases of pyelonephritis treated with successful antibiotic therapy, the BUN and creatinine often return to normal, and the urine-specific gravity will become more concentrated. In early or acute pyelonephritis, the renal pelvis may be normal or only mildly dilated. The proximal ureter can be dilated even without obstruction. The patient may also show subcapsular edema or focal hypoechoic areas near the renal capsule. In acute pyelonephritis, the renal medulla appears normal or hypoechoic compared to normal renal cortex. The dilated renal pelvis is anechoic or pure black on ultrasound. A 2 to 3 millimeter dilation of the renal pelvis of the kidney of a cat or small dog is relatively large and easy to recognize. However, a 2 to 3 millimeter dilation of the renal pelvis of the large kidney of a large dog, like this 83-pound Labrador, is relatively small and easily overlooked. It is important to be in the lateral sagittal transducer position and to look carefully for a dilated renal pelvis, especially in large dogs. In chronic pyelonephritis, part of the medulla is hyperechoic due to chronic inflammation. The cortex often appears to be too thick, but in reality, part of the medulla at the corticomedullary junction has become hyperechoic. Color flow Doppler will show the presence of arcuate vessels to help differentiate between cortex and medulla. Any patient with pyelectasia should have a measurement of the width of the renal pelvis for future comparison. With effective treatment, the renal pelvis should decrease in width or disappear within a few days to a week. Failure of the renal pelvis width to decrease in size to less than 2 millimeters with antibiotic therapy indicates bacterial resistance to the antibiotics being used. The renal pelvis and proximal ureter in this 9-year-old male neutered chartreuse did decrease in size, but not below a pelvis width of 2 millimeters. The renal infection should not be considered to be cleared. Urinalysis and urine culture and sensitivity should be repeated. It is common for patients with immune suppression caused by Cushing's disease, diabetes mellitus, chronic steroid use, or neoplasia to have a secondary urinary tract infection. Expect and look for a dilated renal pelvis in the kidneys of these patients. Note the dilated renal pelvis in this 13-year-old cat. The increased echogenicity of the medulla indicates chronic pyelonephritis. Note the dilated renal pelvis, cyst, and scalloped kidney edges in this 13-year-old lab. Any patient with suspected pyelonephritis should have a urine culture and sensitivity to identify the bacterial cause and most appropriate antibiotic for treatment. In daytime practices, urine cultures often show no growth. Why is this? In most cases, bacteria will only survive about 6 hours in urine unless there is blood or debris for the bacteria to live on. Bacteria like E. coli cause a paralysis of the distal renal tubules, preventing resorption of water, and can result in a dilute urine specific gravity of 1.009 or less. Low urine specific gravity and low osmolality cause bacteria to absorb water and rupture. In most human hospitals, urine is plated for culture within 30 minutes of collection. Note the dilated renal pelvis and scalloped edges of the kidney in this 7-year-old Scotty. The increased echogenicity of the medulla and scalloped edges of the kidney suggest a chronic pyelonephritis. If you do not plate your own urine cultures, how could you improve your chances of getting positive results from a urine culture? Do not collect urine from a patient kept in a cage for 4 to 6 hours or longer. Have the animal taken for a walk to urinate and collect a fresh sample by cystocentesis about an hour later. Centrifuge the sample and pour off the supernate. Swab the sediment and place it in a culturette tube to send to the lab for culture and sensitivity testing. Note the dilated renal pelvis and cyst in this transverse view of the left kidney from an 11-year-old Sheltie. If you do get a negative culture, what could you do? Treat with drugs such as enrofloxacin or Clavamox for 4 to 6 weeks. Owners who did not think their animals were sick often note an improved appetite, improved behavior, and increased activity level within their pets within 2 to 3 days of treatment. The kidneys can also be rechecked by ultrasound in 1 to 2 weeks. If treatment is effective, the renal pelvis will disappear or decrease to less than 2 millimeters in width. Urine-specific gravity will also become more concentrated. This 12-year-old Cocker Spaniel was treated 2 years earlier for pyelonephritis. In this video, the renal pelvis is dilated and the medulla is hyperechoic, indicating progression to a chronic pyelonephritis. The kidney is first shown in a sagittal view and then a transverse view. The urinary tract infection was never eliminated in this dog. Urinary tract infections can recur or become resistant to treatment. Even if antibiotic therapy appears effective, the kidney should be rechecked by ultrasound in 3 to 6 months to be sure that a chronic pyelonephritis is not present. If infection recurs or persists, pulse antibiotic therapy may be needed to try to keep the infection in check.